Good day everyone, I am Jed Cesar Valenzona and today I am acting as Nitroglycerin.
And I am Christian Keith C Nelmida, portraying Isosorbide Dinitrate.
Good day everyone, today we're going to talk about one of the cardiovascular drugs which is nitroglycerin. One of the brand names of nitroglycerin is Nitrostat. The chemical name of nitroglycerin is 1,2,3-trinitroxypropane. Its drug classification is vasodilator and it is also categorized in pregnancy risk category C. Nitroglycerin forms free radical nitric oxide which activates guanylate cyclase resulting in increased guanosine monophosphate in smooth muscle and other tissues. Nitroglycerin is rapidly absorbed following sublingual administration. Its distribution is 3.3 liters per kilogram at plasma concentrations between 50 and 500 ng per ml. The binding of nitroglycerin to plasma protein is approximately 60% while at 1,2 and 1,3-dinitroglycerin is 60% and 30% respectively. A liver reductase enzyme is of primary importance in the metabolism of nitroglycerin. Known sites of extrahepatic metabolism include red blood cells and vascular walls nitrate. Nitroglycerin plasma concentrations decrease rapidly with a mean elimination half-life of 2 to 3 minutes. Half-life values range from 1.5 to 7.5 minutes. Clearance greatly exceeds hepatic blood flow. Metabolism is a primary route of drug elimination. Nitroglycerin is indicated for the acute relief of an attack or acute prophylaxis of angina pectoris due to coronary artery disease. It is contraindicated in patients who are allergic to it. Sublingual nitroglycerin therapy is contraindicated in patients with early myocardial infarction, severe anemia, increased intracranial pressure, and those with a known hypersensitivity to nitroglycerin. Side and adverse effects: CNS, dizziness, weakness, headaches, syncope, CV, palpitations, GI, nausea, and vomiting, and skin diaphoresis. As a nurse, it is our duty to conduct baseline assessments, like record onset, type of pain, radiation, location, intensity, duration of anginal pain, precipitating factors, and assess BP, apical pulse before administration and periodically following dose. PT must have continuous EKG monitoring for IV administration. Question medical history and screen for contraindications. These are the nursing interventions in administering nitroglycerin. Monitor BP, heart rate, and assess for facial or neck flushing. Defibrillator must not be discharged through paddle electrode overlaying nitroglycerin system because it may cause burns and damage to paddle via electrical arcing. Consider NS boluses for hypotension. As a nurse, these are the things that we must teach the patient and the family. We must teach them how to administer the drug, what are the things they must avoid, and what things they should do in order to attain the maximum effectivity of the drug.
My generic name is Isosorbide Dinitrate. I am sold under brand names of Dinitrate SR, Isordyl, Sorbitrate, and Isordyl Tetradose. My chemical name is 1,4,3,6-dianhydro-2,5-Dio-nitrodeglycetol.
I am an anti-anginal
and a vasodilator under therapeutic drug classification, and for pharmacologic drug classification, I am a nitrate. According to studies, my pregnancy risk category is C, which means the benefits from using me in pregnant women is still acceptable despite my potential risks. I have mentioned that I am an anti-anginal and a vasodilator. So what is my mechanism of action? My action is that I promote peripheral vasodilation and reduce preload and afterload. I decrease myocardial oxygen consumption and increase cardiac output. Also, I dilate coronary arteries thus increasing blood flow and improving collateral circulation. Now let's describe my pharmacokinetics. I am well absorbed in the GI tract but undergoes first pass metabolism, resulting in bioavailability of about 50% depending on the dosage form used. Limited information is available on my plasma protein binding and how I am distributed in the body. I am poorly absorbed and metabolized in the liver to active metabolites, then I am excreted in the urine. My elimination half-life is about 5 to 6 hours with oral administration and 2 hours with SL administration.
I am used to prevent and treat angina pectoris due to coronary artery disease.
I am contraindicated with concurrent use of sildenafil, vardenafil, and tadalafil. Also to patients with severe hypotension, hypersensitivity to nitrates, shock or acute MI with low left ventricular filling pressure. Along with my needed effects, I may also cause some unwanted effects. On the nervous system, I may cause headache, dizziness, weakness, and fainting. For the cardiovascular, I may cause flushing, orthostatic hypotension, tachycardia, palpitations, and ankle edema. For the gastrointestinal, I can cause nausea and vomiting. For the dermatologic or skin, I may cause cutaneous vasodilation and rash. Other side effects are hypersensitivity reactions, sublingual burning, and blurred vision. The nurse should conduct a baseline assessment, recording the onset, type, location, gradation, intensity, and duration of the anginal pain. Also the precipitating factors such as exertion and emotional stress. If headache occurs during management therapy, the nurse should administer the medication with meals. The patient or family should know to do not chew, crush, dissolve, or divide me in sublingual, extended release, and sustained release forms. Take sublingual tablets while sitting down and be dissolved under the tongue. Go from lying to standing slowly to prevent dizziness. Take oral form on an empty stomach. Avoid alcohol because it intensifies the hypotensive effect. Report signs and symptoms of hypotension and angina.
So that's all for our video.
Thank you for watching.